My name is Dr. Julian De Silva. I'm a consultant in facial cosmetic and oculo-facial plastic surgery in London. My area of expertise is focused purely on the face, and the three commonest procedures that I perform are eyelid surgery, also known as blepharoplasty, nose reshaping or rhinoplasty, and face and neck lift techniques, in addition to others such as stem cell fat grafting. My expertise extends from over 10 years working in central London hospitals before specialising in purely facial cosmetic surgery. My experience includes spending time in the cosmetic centres of Beverly Hills, Los Angeles, Manhattan, New York, and many of the skills that I use for my patients are customised innovations and surgical techniques from my time in the US. My focus is very much on giving patients natural looking results, and that means hiding scars, using scarless techniques, and wherever possible, generating techniques that result in a rapid recovery as far as possible. I've won awards and prizes in innovation, in research, in cosmetic surgery excellence, and I'm a keen advocate of teaching, and I teach internationally in facial cosmetic and plastic surgery, and I've authorized peer-reviewed journal articles and published book chapters. I'm a keen advocate for teaching the next generation of surgeons. I would say that 10 to 20% of the surgery that I do is complex revision surgery on patients who've had surgery elsewhere. And this requires the use of complex techniques, equipment, and graft tissues in order to give these patients the best possible results. I'm very passionate about what I do. I'm an artist, I'm a sculptor, and I use those skills every day. And I get a great deal of satisfaction from the patients that I treat.
Here at the Gherkin is Dr. Julian De Silva, a cosmetic surgeon with two practices in London. It's great to have you with us tonight, Dr. De Silva. First of all, give us an idea about the size of your business and the kind of procedures which are very popular.
So I specialise very much in the face, so the three principal areas that I help patients with are eyelids and blepharoplasty, nose reshaping and rhinoplasty, and face and neck lifting, those techniques. And I can tell you, just specialising in that one area in the body, it requires a great deal of skill and technique in order to keep up to date with all the advances, and there's continual evolution in medicine, and where we were 5-10 years ago is not where we are today. And as your graphics illustrated, the cosmetic industry has changed dramatically in the last 10 years. Non-surgical treatments, Botox and fillers, were not nearly as accessible, and many didn't even exist 10 years ago. And this is a continual evolution. With every patient I treat, I spend more than 2 hours with every patient before I contemplate doing surgery on them. And that's so I really know exactly what they want, what the patient's expectations are, and also give them an idea of what those risks are. And if I was to give you one example, eyelid surgery, or also known as blepharoplasty, is the most common cosmetic surgery in the world.
Yes.
It's regarded as a relatively safe procedure. However, there is a tiny chance, a less than 1% chance of blindness after blepharoplasty. And I tell every individual patient that there is a tiny risk of this happening. Of course, there are steps you can take to reduce this, to minimize it. However, at the end of the day, surgery is surgery, and occasionally unexpected things occur. And I think that's when we're talking about regulation, we're talking about training staff, whether they're doctors, whether they're nurses or other individuals, so that they're aware of the potential risks of doing some of these procedures. The chance of having complications from a Botox or a filler is relatively very small. However, if you don't understand or appreciate the anatomy of the face or the potential risks, then there's definitely a call for further regulation to help with that.